Well, welcome to Medical Dialogues. I'm Roshni. Let's look at today's top health news. CDC proposes common antibiotic as morning after drug against STIs. The US Centers for Disease Control and Prevention is preparing to suggest the use of a potent antibiotic for preventing sexually transmitted infections. The CDC recently released preliminary guidelines advising healthcare professionals to consider prescribing doxycycline as a preventive measure against the spread of these infections. This approach, known as Doxy-PEP, short for doxycycline post-exposure, suggests taking the antibiotic following a potential exposure to an STI rather than waiting until a disease is diagnosed. If these initial recommendations are accepted, Doxy-PEP would be recommended for individuals other than gay and bisexual men, including men who have sexual relations with men and transgender women, provided they have previously been diagnosed with at least one STI caused by bacteria within the past year. These infections include gonorrhea, chlamydia, or syphilis. The CDC is expected to advise healthcare providers to consider prescribing a 200 mg dose of doxycycline within 72 hours following sexual intercourse for these specific groups. However, the CDC requires further data before extending these recommendations to other populations. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. It's worth noting that the CDC is not the first organization to endorse this strategy. Health departments in various states such as California, Michigan, and New Mexico, among others, have already provided guidance on Doxy-PEP. David Harvey, the executive director of the National Coalition of STD Directors, expressed support for the proposed recommendation. The CDC is seeking feedback on these guidelines for a period of 45 days, with the comment period ending on 16th of November. A final version of the guidelines is expected to be published early next year. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.